Surviving a stroke is hard enough, but getting back behind the wheel of a car is another challenge.
Which patients are capable? A new study looked at some tests to help determine the answer. Dr. Jay Adlersberg has more.
Miriam Babad's altered walking is the result of a stroke a dozen years ago. She's behind the wheel now, not the case right after the stroke.
I needed somebody to do all of my errands and all of my goings and comings. I needed somebody to take me. Even to get to the railroad station, you need a car.
So to make sure she could drive again, Miriam did some tests which the study found best predicted who could pass an on-road exam. One checked hand-eye coordination and thinking with alternating dots.
Your job is to connect the dots.
Another tested spotting things out of place, such as this arrow pointing right when traffic obviously has to go left. After a stroke, patients may not be aware that they have problems coordinating their hands on the wheel, their eyes on the road, and their feet on the pedals. To detect these problems, a driving simulator. The study found it was the most predictive of real-world success. It can show with split-second accuracy how good are someone's reflexes and mind-muscle coordination.
I look for them performing within a range that makes them look like other drivers. That suggests that they have the ability to drive.
Reporting that someone may be driving impaired is mandatory only in New Jersey and Pennsylvania around here. Dr. Gianutsos thinks doctors and therapists should voluntarily send stroke victims for testing. Patients with Alzheimer's or dementia can also be tested. And Miriam, special glasses helped her slightly impaired vision. After passing the off-road test and brushing up on the road with a driving instructor, she returned to four wheels.
Unless you're willing to walk a half a mile to a bus, you're stuck. So it lets me live like a regular person. Thank God, as you see, we haven't gotten into any accidents.
This is Dr. Jay Adlersberg, Channel 7 Eyewitness News.
And that does it for this 5 o'clock edition of Eyewitness News. We thank you for watching. I'm Diana Williams.
And I'm Sade Better-en-Moi. Eyewitness News at 6 starts right now.